Okay, so with the convoy not backing down on its cause, the question is, will there be more protests happening in Toronto and perhaps other cities? And how could that impact Hospital Row, which was a big concern this time around? For more, I'm joined by Palliative Care Physician Dr. Naheed Dosani. Welcome back to Breakfast Television.
Thank you so much for having me on, Melanie. Good morning.
Good morning to you. Okay, you were one of the organizers behind this counter protest that we saw. Hundreds of healthcare workers turned out. Take me back to Saturday, what the turnout looked like, what the feedback was on the ground there too.
Yeah, for context, a couple of issues have come up recently. The first is that Toronto healthcare workers were asked not to wear clothing or attire that would identify them as health workers because of safety concerns. And the second is, there was the freedom protest that was happening in Toronto. And many people know the geography, but Queen's Park is very close to Hospital Row. And so there was a concern about compromised healthcare. So we joined forces with hundreds of healthcare workers from different disciplines, different walks of life, who came together to make a stand and stand united for access to healthcare and to ensure healthcare was not compromised. We talked about vaccines, not vitriol, treatment, not threats, health, not hate. It was a show of solidarity. It was powerful. It was harmony. And it showed that the way forward is through healthcare, through empathy and compassion.
Dr. Dosani, overall, it looks like those who were protesting were cooperative and allowing healthcare workers to get where they needed to go. There were some delays with ambulances here and there. What are you hearing from some of your colleagues when it came to the response?
Yeah, I think the main objective of the protest was to ensure healthcare access was not compromised. And by and large, what we did here was that, healthcare was able to be accessed by patients, the people receiving chemotherapy, for example, on that street, the children in need of care. We also heard of healthcare workers who were able to access their jobs. Some had to actually walk further distances than they would have potentially normally had been because of the protest. But by and large, healthcare was not compromised. And that was an objective of our protest and why we came counter-protest. And that's why we actually came together. So that was definitely made clear.
I want to get your take on some of the messaging that we've been hearing from some of our government officials as of late, and it's the idea of learning to live with COVID. We are almost 2 years in. We're about 2 years in. From a healthcare perspective, being on the front lines, when you hear that messaging, where do you go with it in your head? How do you feel when you see your patients in front of you and saying we need to learn to live with it? Are you on board with that?
Yeah, I think, first of all, of the many healthcare workers across this country who have sacrificed so much, dedicated so much, persevered, worked double shifts, worked overtime, given their all, and are still going on this marathon. We're on, the second or third marathon. To be honest, this is a never-ending story, and there's been so much trauma and so much suffering that so many of us have witnessed. I also start to think of the fact that COVID-19 does not impact us all equally. There are many people in our communities who are people with disabilities, people with multiple medical illnesses, our frail elders who are more susceptible to COVID-19. And we have to be wary of some of the messaging around this in terms of ableism and the fact that learning to live with COVID can actually have a disproportionate impact on those who are most vulnerable in our communities. I get that people are frustrated. I get that we do have to, think about moving forward, and businesses have been impacted. People's income has been impacted. So I get the sentiment, but I do worry about my patients who are most at risk.
Very well said. Dr. Dosani, I have a feeling we will be chatting again very soon. We appreciate all your work on a daily basis and for taking the time out to talk to us. Thank you.
Thank you so much. I appreciate you. Have a good day.
You too. And that is Palliative Care Physician Dr. Naheed Dosani. Some interesting points there, Sid. When we have that messaging, I know this is not the topic of what we're going to bring in, but the learn to live with does mean something different to everyone you talk to.